Welcome to my presentation of a physical activity intervention program based around someone living a sedentary lifestyle. My name is Jessica Brennan. My client is a 21-year-old female who is working as a full-time nurse after completing her university degree last year. She is 172 centimeters tall and weighs 51.2 kilograms, meaning her BMI is 17.3, which places her in the underweight category. While she does do some physical activity, she doesn't do enough and struggles to incorporate strength training into her regime. After the 2-week physical activity analysis, it became apparent that the client wasn't participating in enough physical activity and was below the standard average of daily steps. Currently, she is only participating in around 60 minutes of exercise a week, at a low intensity, mainly involving walking in comparison to the recommended 150 to 300 minutes per week. She is well below the recommendation. As she is a nurse and works shift work, her schedule isn't consistent and this makes her routine hard. However, she did manage to attend a few group fitness classes in the 2-week analysis. On top of this, her daily average step count was calculated by her Apple Watch, and she recorded an average of 7,787 steps per day, compared to the target of 10,000. She is below this, as she is also below the world average step count, which is only currently 9,448 steps per day. Her risk factors all come from her lifestyle, as she presented with no risk factors during the screening process. As a result of the lack of physical activity, she is already at risk of mortality and increased risk of developing chronic illnesses such as cardiovascular disease, diabetes, obesity, colon cancer, high blood pressure, osteoporosis, which is increased because she is a female, lipid disorders, and mental health disorders. It is important that we increase her behaviours because unfortunately research has shown that shift working such as nursing increases your risks of developing chronic illnesses. In particular, nurses are 64% more likely to develop cardiovascular disease than those counterparts who work 9 to 5 shifts. The program itself has been developed around the SMART goal principle. These are specific. The program was developed around 12 weeks into smaller sessions that build on each other with intensity and adaptability for the client. The program is measurable, seeing increased sessions throughout the program, increased strength and fitness components, and increasing her BMI from muscle increases. The goals are achievable. This is because the program is flexible, so the client can fit it in and the sessions aren't specifically planned. The goals are realistic. The flexibility means she doesn't feel like she's locked into doing a session after a busy working day or when she's stuck at work. This means that she doesn't feel pressured and she doesn't feel like she's failed if she hasn't been able to complete a session. Finally, the goals are timely. They are set out across 12 weeks with incremental increases of increasing intensity and fitness levels so she can increase her cardiovascular fitness and strength. The specific goals the client has outlined she wants to increase are increasing her physical activity, have an ability to create a routine, increase her strength and cardio fitness, whilst also increasing her BMI through muscle gain. The program itself is set out into different aspects. The red table is the various warm-ups that can be done at the gym or at home to ensure the client is ready to participate in physical activity. The orange table represents the gym program, with an upper body, lower body and mixed strength program which can be slotted into the week when she has the ability to come to the gym. The yellow table is a cardio program for the gym and at home. The program involves around different intensities, including aerobic and anaerobic fitness, which isn't included until week 7, as well as a program which can be done at home, such as walking or going for a jog. The green table is a specific program that can be done in the comfort of her own home when she can't make it to the gym. The program requires no equipment and the sessions will be short and easy to complete, so she can do them after a shift or before she goes to a shift when she knows she won't make it to the gym. The teal table is the cool down table. These are for at the gym and at home after she's completed a workout to ensure she recovers properly and stretches her muscles out. The darker blue table at the bottom incorporates the group fitness the client has indicated she enjoys, such as body balance, CX Works, and RPM. These all involve balance, strength, and cardio fitness. The next table outlines when and how the client will increase the intensity of each program. For example, the strength-based program at the gym increases the percent weight of her 1RM that she'll be lifting throughout the program. In the final week, she'll be lifting 65 to 75% of her 1RM as she will increase her strength and will be able to lift more weight. The final table outlines how many sessions she will be doing a week, starting with 4 to 5 and gradually increasing to 7 over the 12 weeks. This will help to reduce fatigue, burnout, or injury. Finally, the behaviour theory I have adopted is the self-determination theory, which entitles the following: competence, which involves some education around the use of the equipment in the gym, as the client admitted she was unsure of using the gym equipment, which has previously stopped her from using the gym. Relatedness. This is where the group fitness aspect comes in. This offers a social aspect for the client and ensures that she feels part of a group. Finally, autonomy. This is where the flexibility of the program comes in. Because the program is flexible, she won't feel like she's failed the program if she couldn't do a session because of her work. Thank you very much for listening. I look forward to your questions.